Before you have the procedure, you'll also be asked to go over whether you've got any particular reactions or allergies that might be important in the scan. And there'll be a full questionnaire given to you and asked prior to the procedure. So it depends a little bit on what we hear from the patient. There'll be a few questions you ask. It's not complicated. We rarely don't do the scan. We'll have to put a little drip in there, a little plastic drip in the arm, usually in the elbow if we can, sometimes on the back of the hand. And that's done before the procedure and before you go into the room. And we use that so that we can give the dye, or is known as contrast, during the course of the scanner. We sometimes have to put a little bit of beta blocker, which is an intravenous drug, which slows the heart rate down and takes a bit of the adrenaline that we all pump, takes the edge off that as it goes around the body. So when you actually get invited into the room, first thing to remember is try to stay relaxed. It's very straightforward, it's not a difficult test, you're not going to have to do anything very complicated, and the more relaxed you are, the better your heart rate and the better the picture. So remember that as your top priority. And the reason for that is your heart is tucked underneath your ribs and we have to take a picture over a few seconds. What I'd like you to do is try and hold your breath for about 5 seconds, 3 times on 3 separate occasions, about a minute apart, so you've got plenty of time to recover. Sometimes we do 4 scans, but usually 3. The first scan is always a setup scan, and that's a very quick scan.